Start.
Hello, this is Dr. Trivedi, a doctor working here today in this clinic. May I confirm your name and age, please?
Hello, doctor. Good morning. My name is
Good morning.
Greta and I am 29 years.
Well, how may I address you?
Please call me Greta.
Okay, Mrs. Greta, today we are going to discuss about your health issues. Is that all right?
Yes, doctor.
Okay, and during our discussion, I might take down some notes, which will be strictly confidential. Is it okay with you?
Okay, doctor.
Okay, now, Mrs. Greta, can you please tell me in your own words what have actually brought you here?
This is the for the last 3 months, doctor. I have noticed that I am coughing frequently day, and this cough is increasing day by day. And even now, I even cannot sleep properly at night due to this cough. Some bouts of cough that persist for a few minutes, sometimes 1 or 2 minutes. But when this comes, this is so severe that I even cannot do any jobs. I cannot even take a good sleep at night due to this cough. Though I haven't produced any film during this time, but this dry cough is also hampering my quality of life and daily activities. I visited my GP about 1 month ago, saying that I am having this problem. Thought that it might be due to some viral illness. He thought that it is called post-viral hyper-responsiveness or like this something, because I had some fever, and he gave me some cough suppressant medication, but that didn't help me a lot. And again, I visited him, and this time he was thinking that I have asthma, and he gave me some inhalers, but that is not also helping me now. So I'm quite worried, doctor, that what is happening with me.
Okay, I can get you, Mrs. Greta. I will try my level best to find out what's troubling you. You told that you have started coughing 3 months back. Can you please tell me whether it came along suddenly or gradually?
It came, I think I started somewhat gradually and increasing
Okay. And could you notice that whether you ever produced any flame or had it been dry all around?
all time dry.
Okay. And can you tell me that how frequently do you experience these episodes now?
Doctor, sometimes more than 10 times a day.
Okay. Have you noticed that is there any specific time period when this occurs more?
No, it comes, it can come at any time, but daytime,
At
nighttime, at any time.
Okay. Have you noticed that is there anything that makes it worse, like walking or doing some exercise or anything like that?
No,
Okay. Anything that makes you feel better?
no,
Okay. But can you please tell me that have you ever experienced any blood in your cough?
no,
Okay. And okay. And can you please answer me some other questions? That have you ever had any chest tightness,
no,
any noisy chest,
no,
any chest pain?
no,
Okay. You told that you having been having cough. Can you please tell me that do you feel any shortness of breath?
no,
Okay. Any use of pillows, extra pillows to be comfortable at night?
no,
Any swelling of your legs?
no,
Okay. And any racing and pacing of your heart?
no, doctor.
Okay. May I ask you that do you have any runny nose? Any history of runny nose? Previous
No,
episode?
no,
Okay. Any previous history of frequent nose infections or something like that?
no,
Any episodes of no bleeding from nose?
no,
Okay, bleeding up from any other sites?
no, doctor.
Okay, and may I ask you that how about your digestion? Has been have a how about your movement? Has it been all right always?
No, doctor. I am facing that I have been constipated for last 2 months.
Constipated. Okay. Uh, okay. May I know that how many times do you have? Can you open up your bowel
About 2 to 3
for
times
a week?
a week. That is about every 2 to 3 days.
Okay. Can you please remember or tell me that how is your bowel movement, bowel work? Is it firm or solid or soft?
I think it is somewhat hard.
It's somewhat hard. Okay. Have you ever noticed any blood in it?
No.
Okay. And have you ever okay? And have you ever noticed that? Um, sorry. Have you ever noticed that you feel any tummy pain?
Yes, doctor. Sometimes I
Okay.
have tummy pain.
Okay. And may I know? Can you please tell me that where it is the pain?
It's all over my tummy.
All over your tummy. And do you have any relation with this bowel movement of your tummy pain? Relation with tummy pain?
No, doctor. Sometimes it comes and goes.
It comes and goes. Okay. Okay. And you what about your bowel movement? Can you please tell me that is there any relation with specific type of food
No,
constipation? Okay. Anything makes you feel better of this
no,
constipation?
I haven't noticed.
Anything making it worse?
No,
Okay. And how about your actually? How about your digestion? Have you ever been Have you ever suffered from any problems of your uh, how can it of your digestion? Like uh, I've actually okay. Have you ever had your food come heartburn? Any history of heartburn?
no, not like that.
Okay. And any time you experienced that your food coming out from your mouth?
No, doctor.
Any sour taste in your mouth?
No,
Okay. Any type of any time you felt that a food coming out through your nose?
no,
Okay. Now let me ask you some other questions. Do you have any headache?
no, doctor.
Any changes in your vision?
Not changes in my vision, but I had some red eyes about 1.5 months back.
Red eye. Well,
Well,
you told that
yes.
you had some red eye 1.5 month back. Did you seek any medical attention for that?
No, doctor. It went on its own.
Okay. Do you have any soreness in your mouth?
No,
I'm very sorry to ask you one private question, but I have to ask you: do you have any soreness in your private parts? Have you
no,
noticed any?
no, no, no.
Okay, that's all right. Do you have any joint pain?
Yes, doctor. That is also a new thing for, I think, for last 3 months.
Okay, may I know which joints?
My elbow, my knee, my wrist.
Okay, okay, I can get it. And do you have you ever noticed any redness or any pain in this, or any redness or warmth in those joints?
No,
No redness. Okay. And have you noticed anything that makes your joint pain worse, like working or taking rest?
taking rest makes it worse, doctor. Because when I take some rest, I think that there comes, and in the morning I also have this pain. And after doing some work, I feel somewhat better.
Okay, okay. And may I ask that are the joints involved in both sides, or only one side of your body?
Both sides, doctor.
Both sides. And do you have any pain in your hands?
Yes, doctor. I think all over my joints.
All over your joints. Okay. And may I ask you that do you feel any pain while walking in the heel in your heels? Do you feel any pain?
No,
Okay. Do you feel any back pain?
no,
Okay. And may I ask you that after starting feeling this joint pain, did you seek any medical attention?
no, doctor. I just took some paracetamol for that.
And how is your joint pain now?
I can manage with that, but that is somewhat bothering.
Somewhat bothering. Okay. And okay. And may I ask you some other questions now? That how is your water work? How about your water work?
I also noticed some problem with my water work, and I am passing my water more frequently.
Okay. For how long?
Maybe for last 3 months.
Okay. Do you feel any pain while passing your water work?
No,
Okay. Any pain in your tummy while passing your water work?
no,
Have you ever noticed any blood in
no,
your water work? Okay. And any poor stream or dribbling?
no,
Okay, and may I ask you now that did you had any episodes of loose motion or any chest infection 3 months back when these symptoms started, like your joint pain or
No,
differences in
no,
your
no.
body? Okay, okay, that's all right. May I ask you now some other questions? That do you have any known disease condition, long-term disease condition, or any other disease condition?
I had asthma in my childhood, but I am not taking any medication for about last 20 years.
Okay, for the last 20 years, has you been all well?
Yes,
Has you
doctor.
Okay, okay, that's all right. And okay, and may I know that do you have any known family history of diseases, any long-term diseases?
My father had high blood pressure, nothing else.
Okay, and any history of sudden death in your family?
No,
Okay, apart from now, let's go move to your medication history. Apart from your paracetamol, do you take any other medication? Mm. Okay, apart from taking paracetamol, do you take any other medication?
yes, doctor. I am taking some inhaler that doctor suspected that it is asthma, and also I take some cough suppressant medicine. I cannot name those.
Okay, okay, and uh, well, can you please tell me that do you take any over-the-counter medication?
No,
Any allergy to any medication?
no,
Any herbal medication?
no,
Any history of blood transfusion in your blood channels?
no.
Okay, and I'm sorry, very sorry to ask you this question, but this is a personal question, but it's important to know. Do you ever take any recreational medication?
No, doctor, never.
Okay, that's all right. May I ask some other personal questions? Do you smoke cigarettes?
No,
Okay. Do you drink alcohol?
no, doctor.
Okay, that's all right. May I know that actually these questions are personal, but these are important actually. Do you take any pills for as a contraceptive measurement?
Yes,
Okay. For how long?
for 5 years.
Okay. Okay. That's all right. And may I know that again a personal question? May I know whom do you live with?
Living with my husband.
Yes. May I know that have you ever tried to conceive?
No.
Okay. And may I ask you again that how is your period? Is that all right?
Yes.
Okay. Okay. May I ask you that do you have any history of clotting in your previous history of clotting in your of blood channels?
No.
Any family history of that? Can you remember?
No.
Okay. And may I ask you that whom do you live with, where do you live? In an apartment or house, something like that?
Apartment.
Okay. Is it a new apartment or old one?
No.
Okay, that's all right. And do you have any pet in your house?
No.
Okay, and may I know what you do for a living?
I'm a office clerk, doctor.
Official, that's all right. And may I know that do you have to deal with a lot of lots of dust or something like that?
No, no, no.
Okay, has there been any recent shift in your workplace? Have you noticed any?
No.
Okay, that's all right. And may I know that that's again important. That have you been to any travel to any country recently?
That was 1 year back. I traveled to India.
Okay, and during that stay, uh, uh, did you in which areas did you visit? Can you please remember?
It was Taj Mahal.
Taj Mahal. Okay, and were you all right at that time?
Yes,
During
doctor.
that time? Yes. Okay. And after coming back, also were you all right? Or
Yes.
did you have any problem? Okay. Okay. That's all right. That's all right. Now I'm very sorry to ask some very personal questions now. Actually, may I proceed? Actually, that's important. Actually.
Okay, doctor.
Okay, okay. But now, Mrs. Greta, actually, can you please tell me that you told you are living with your husband, but may I know that did you ever had any casual relationships?
No, doctor, never.
Okay, that's all right. I'm very sorry to ask, actually. Uh, okay. Uh, well, may I know that what your concern is, Mrs. Greta?
Why I am having this, doctor? Why it is not improving with those medications?
Uh, yes, Mrs. Greta, I can understand your frustration. Well, actually, at this moment, I have to examine you thoroughly and also do some tests of you. After that, I can explain to you more properly what has happened to you. But as long as I have taken your history, I think that there is a possibility that you might be suffering actually from problems of your joints. Okay, and I think this can actually uh, cause problem with your chest as well. Okay, I think yeah, what we call this is some seronegative arthritis. Are you getting me?
Yes, doctor.
Yes, actually, don't bother about the term. It's actually a condition when our defense system can destroy some tissues like our joints, and also cause some problem with your vision and also our water work. Are you getting me?
Yes, doctor.
Yes, at times it can also cause some problem in your chest and cause some coughing or shortness of breath as well. However, we are not totally sure about it just at this moment. We will have to involve the joint doctor and other doctors, and we will run some tests. And after that, we can get you more appropriately. Are you with me, Mrs. Greta?
Yes, doctor.
Okay. Do you have any more concerns or any more questions?
Do I need any admission?
Okay. I think at this moment, we will at first consult with our chest doctor and joint doctor, and we will get you to know as soon as possible whether you need admission or not. Is that okay?
Okay, doctor. So when will you let me know that?
I will just let you know as soon as possible. As soon as possible. I'm just going to consult with them as soon as possible,
Okay, doctor.
and I will try to be. I will try to let you know within you stay in the hospital premises. Okay.
Okay, doctor.
Okay. Any more concerns?
No.
Okay.
So what is your diagnosis?
Well, I'm at this moment I'm not totally sure about it, but I think that the patient might be suffering uh, from. I'm not quite sure actually, but she might be suffering from this cough due to some seronegative arthritis. I think most probably Reiter syndrome or something like that.
Okay. Do you have any
And
differential diagnosis?
I think well, uh, she might also be suffering from rheumatoid arthritis along with ILD, and she might also be suffering from. She might also be suffering from, I think, cough variant asthma as well. I think that can also be a possibility.
Any other multi-system involvement disease?
Yes, yes. I think there are some other possibilities as well. I think regarding that, she has some increased water work. I think she might sarcoidosis and tuberculosis can also be important disease here.
Okay, sarcoidosis. So any other thing that you should have asked for sarcoidosis in this lady?
Uh, yes, I think uh, for sarcoidosis, I asked about polyuria, polydipsia,
Anything that you should have asked?
weight loss. I think I asked that.
I cannot
Uh,
remember that you have asked about weight loss or not, and also I cannot remember that you have asked about any rash, especially for any erythema nodosum.
No, no, I asked about rash. I asked about rash. I remember. I asked about rash, both in the rash and both in the private person. Also, I think I asked.
I think
Or
you
or
have asked about an overall source, not rash.
okay, okay. I missed it. Okay, that might be the case. Well, then I have missed it completely.
Okay.
I just don't remember.
Also, for tuberculosis, you haven't asked about any fever, history of any fever.
Yes, I think actually today I missed quite a lot of things. Actually,
I told you that I had some fever, so my doctor suspected that it was post-viral hyperresponsiveness.
yeah, I actually fever. I lost fever. I forgot fever, loss of weight, weather
But
preferences.
From the
All
from the cough, from the history taking, cough history taking, that was somewhat fine. For cough, your respiratory system evaluation was good,
yeah, yeah, yeah,
and the cardiac system evaluation, that was also good. Yeah, for associated symptoms, you have missed quite few things.
yeah, 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 yeah.
Okay, and also in the red flag symptoms, you also missed quite few things like
Yeah.
weight loss, and also
Mm.
for sarcoidosis, other red flags are signs of hypercalcemia.
Yes, yes, yes.
Okay, and also after that, past history you have went that well, and after that you messed up with family history and drug history.
Mm.
You interestingly asked that, and in the personal history you have asked about
Mm.
smoking, alcohol, occupation,
Mm. Mm.
housing issue, pet issue, that was fine,
Mm.
and also any problem at work, that was also fine.
Mm. 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 Mm.
And in this you have asked also pill free pregnancy, that was also fine.
Mm.
Okay,
Okay, okay, okay.
and for eye vision sense, what do you think the causes of redness of our eyes?
I think there can be some specific causes here. I think there can be, according to uveitis or I think scleritis, episcleritis. This can be the main things here.
Yes. It was, and also for this lady that she has symptoms of hypercalcemia, she needs admission, and she needs steroid injection.
Yes, for her radar. Okay, okay, okay. Why steroid injection?
She has
What?
symptoms of hypercalcemia.
Okay, that's I didn't know. That's very helpful to me.
Okay, you did well.
Okay, okay. I think that we can end the recording.